We always have to look at the other side. How good is our healthcare in India? The poor person who is coming under scheme, obviously he or her is thinking they're getting all the treatment. But believe me, friends, they are not. When people only talk about cost and see how cost is going up, one should compare to what is the cost in countries like United States or Europe. So India has pioneered HCG as one of the pioneers in reverse innovation. Yes, when I say cost, we should really talk about what is the right cost. Like I always say, there is cost to low cost. The answer is not low cost. The answer is right cost. It is time to relook at our healthcare system, relook at what are the lessons we learned from these schemes and others, and see how we can establish a universal health care. Our people deserve proper health care for the proper disease at the right time. Hello everyone. There has been a lot of discussion about Indian healthcare, where we are and where we are headed. Frequently, there are articles, social media, journalists talking about the cost of healthcare in India. But we always have to look at the other side. How good is our healthcare in India, particularly in big cities, where truly healthcare has improved a lot over the last few decades? As an oncologist who has practiced in United States for 25 years, and I've come back and started HCG, group of hospital, I can say very clearly that the major hospitals in India provide the same care or better than most of the centers in the world. Why am I making this kind of a dramatic statement? Having experienced both sides, let us say, for example, somebody has the disease in which I specialize, cancer. On a Monday morning, they come, we do a biopsy, we do the scan, we do a multidisciplinary clinic discussion. Within 3 to 4 days, I can have this pathology reviewed, I can have the scan done, multidisciplinary, a rapid MDT, and give an opinion and actually start the treatment within a short period of time, within days. This is totally unthinkable in countries, most of the European countries, in United States, possibly in other countries. So India has really achieved something which few countries are able to achieve. And let us talk about the technology. Today I can proudly say in HCG, we have the technology for cancer care, linear accelerators, PET scans, cyberknife, genomic instruments. Let me take a minute and explain about what we have recently installed. Proteomics unit costing nearly 22 crores. But we don't expect return on investment. We just want to break even. And when you look at such kind of technology on par or surpassing the world, best centers in the world, yes, there is a cost to it. When people only talk about cost and see how cost is going up, one should compare to what is the cost in countries like United States or Europe. Per person in United States, they spend $10,000. In Europe, it is $5,000 to $6,000. China is $600, $700. India spends $85. So we are spending very little, only 1.5% to 2% of the GDP. But we are getting such fantastic care. It's primarily because of reverse innovation. This has been a study at Harvard Business School. We have all been written up how we are able to achieve this kind of excellent care at relatively low cost. Yes, when I say cost, we should really talk about what is the right cost. When you bring such technology, innovate, research, the type of talent we acquire. In the past, all this talent used to go abroad. Why are they staying back? What do we have to pay them? When you include all that, for a value based medicine, we are probably the number one in the world. What is value based medicine? Certain procedure which may cost, let us say, $100,000 in advanced countries, we may be able to do it for $15,000 and get the same outcome or better. That is value based. So India has pioneered. Unfortunately, we were also quoted HCG as one of the pioneers in reverse innovation. So I want to take it one step further. See, there was a time in India when we didn't have technology. We had only cobalt unit. We didn't have PET scanners. People were okay because they said cost is very low. But the outcome of this disease was not good. As we all know, cancer was considered a dreadful disease. People said anybody who goes with cancer will not survive. Because we didn't have the knowledge, technology to treat them properly. Fast forward to 2025, we are very proud. We have the technology. In India, 77% of healthcare is private. Private has really done a tremendous job in bringing the technology to India and competing with best of centers in the world. But there is a cost to it. We can't deliver this kind of treatment at the same cost as what it was 20 years ago. But proportionately, yes, there has not been an increase in the per capita income throughout India. But there has been differences. Per capita income of Bangalore may be much higher compared to rest of Karnataka or India. Per capita income of Delhi or Gurgaon is higher. Maybe Bangalore, Delhi or Mumbai are equal to East European countries. So India is multiple countries within a country. We have urban India, we have rural India. The per capita income is different, living standards are different, expectations are different. We cannot club all these things together and say, hey, our per capita income is only per year $2,000, so later this cost is very high healthcare. We cannot. We have to look at it where the high income is, where most of the technology is, what are the expectations of the people. Imagine people in the past were going abroad for care. When I was a child or went to medical school, all I heard was people going for heart surgery or cancer therapy to Europe or US. Today, hardly anybody goes. Moreover, it is reverse. People from other countries, Middle East or Africa, are coming to India because of this value-based medicine. You take our own data from HCG, where we have clearly shown how improvement has happened. Let me give you a couple of statistics. In 2017, when I started looking at the mortality rate of HCG across HCG, 5,500 discharges were done from the hospital. The mortality was about 2.8%. People said it is fine, any hospital will have 2 to 3%. We said that is not acceptable. We started looking at this mortality, what happens, post-operative mortality, quality of life, can we improve? I'm very happy to say, just by taking some measures and conducting tumor boards, clinics, in 2025, our monthly discharge is 13,000 to 14,000. Our mortality is 0.9%. 0.9. A remarkable improvement. Probably one of the best in the world. We should be really proud of it. Of course, there is a cost to this. When you bring in technology worth millions of dollars, HCG doesn't give dividends. We flow the money back into the system to buy more technology. That is how we can meet the challenge of cancer and how to win the war on cancer. Like I always say, there is cost to low cost. Look at, for example, the government schemes, Ayushman scheme. What has happened in this? Of course, the system will not agree. They say we'll give you 5 lakhs. And they say we will not give reimbursement for certain things. How can you manage a disease like cancer in that amount? So what happens? People don't get right treatment. I saw a young lady, just to give an example, 28-year-old with breast cancer, who was denied a certain drug called Herceptin because of the scheme. 2 years later, she came with disease all over her body, and the people said the reason we couldn't give Herceptin because the system would not pay. Is that right? Morally, ethically, is it right? Who is responsible for it? The doctor has the knowledge. Do you know what a doctor goes through to become an oncologist? MBBS for 5.5 years, then 3 years of medicine or other specialty, then another 3 years of major degree like DM, MCH or DNB, almost 10 years or more of training. They have the knowledge to do the right thing, but the financials come in the way and they are denied. The right treatment is denied. So when these limited schemes are there like Ayushman, they are half-baked. They really do not serve totally the purpose. The poor person who is coming under scheme, obviously he or her is thinking they're getting all the treatment. But believe me friends, they are not. The system needs to change. While we take pride that we have improved a lot in our care, the private are now penetrating even tier 2, tier 3 cities, but certainly we have not optimized the outcome in tier 2, tier 3 cities, particularly patients who come under the schemes. But on the other hand, affluent people who can afford are getting the state-of-the-art therapy and getting the same outcome in private enterprise. This kind of dichotomy is obviously not correct. There is an answer. The answer is not low cost. The answer is right cost. And let us create a universal healthcare so the rich and the poor can be treated same way with no limits. So when you see a 28-year-old person, or when you see a young man with certain cancer, or a lady with breast cancer, a young man with oral cancer, you can provide them the same treatment you would do for even an affluent person and get the same outcome. That should be our vision and mission. As a doctor, that is what I would like to do. But our hands are handcuffed now because of these kind of schemes and other things which are coming in the way. Please remove the handcuff. Let us do what is the right treatment for our patient. That is what we are trained for. And get the right outcome. Today, India has evolved as a major healthcare destination, as a major pharma company with producing generics at low cost. We are also innovating technology locally. There is a mini revolution taking place. Let us be part of it and bring about universal healthcare. What is universal healthcare? It's very simple. I always believe simplicity in complexity. What is so simple? India is full of youths. Youths are not supposed to get disease, healthy, they're working. All of them have cell phones. Why can't we charge a cess, healthcare cess, and create an autonomous body, not a government body, autonomous body involving private and public sector. And this autonomous fund will keep growing by investing in the public markets. It will also get additional income from excess tax on cigarette, excess tax on liquor. Of course, the ideal thing would be to ban cigarette. Then certain 30-40% of the cancer will go away. But unfortunately, the system is not ready. When I ask the officials, politicians about it, they say we are not ready because it's a great source of revenue. But at least can we make such high taxes? Can we use that high taxes to this foundation where the big money in terms of billions of dollars endowment is built? This will keep growing, will also take care of all sections of the population. You have a card like your Aadhaar card, which can be linked to the Aadhaar card. When you go there with your card, you get free care. Maybe certain initial amount you have to pay for certain things, small amount, you're registered and you get free care, irrespective of your socio-economic status. It is time to do it. Rich people, affluent people should contribute based on their salary structure, based on their job description, compulsorily should contribute to this. One way, like I said, is the phone. If your phone bill is, let's say, 5,000 rupees, 10% should be cess for your healthcare cess. Why can't we do this? India has 1.4 billion population. As we all contribute to this, is it difficult to collect nearly $200 billion and grow this to $1 trillion over the years and make sure we become one of the most advanced countries in healthcare? Countries like Brazil have done it. Why can't we do it? We have to have that motivation and the mindset to do. Negativism will not take us anywhere, and half-baked system will not take us anywhere. Our people deserve proper health care for the proper disease at the right time. Let us do it with this kind of motivation and determination. My request is, in 2025, it is time to relook at our healthcare system, relook at what are the lessons we learn from these schemes and others, and see how we can establish a universal health care and health care for all, irrespective of their socioeconomic status, with no limits, so the right treatment can be given at the right time. Thank you.